Join me as I take on the challenge of debunking some of the most common cholesterol myths in under 3 minutes. Cholesterol is a topic that's often shrouded in mystery, and understanding the truth behind it is crucial for our health. Many people still believe that all cholesterol is harmful, that it's the main cause of heart disease, and that eating foods high in cholesterol will automatically raise our blood cholesterol levels. Some even think that cholesterol is always bad, and that we should avoid it at all costs. Certain individuals are under the impression that cholesterol-lowering medications are the only way to manage high cholesterol. Another common misconception is that cholesterol is only a problem for older adults. There's also a misconception that all cholesterol is created equal, and that it's all treated by the body in the same way. The idea that dietary cholesterol has a direct impact on blood cholesterol levels is also a common myth. People often believe that if they eat foods high in cholesterol, their blood cholesterol levels will skyrocket. Cholesterol comes in different forms, including HDL and LDL, which have different effects on our health. HDL cholesterol is often referred to as the good cholesterol because it helps remove other forms of cholesterol from our bloodstream. On the other hand, LDL cholesterol is often called the bad cholesterol because high levels of it can lead to plaque buildup in our arteries, increasing our risk of heart disease. HDL and LDL cholesterol are both essential for our bodies, but they need to be in balance. When we have high levels of LDL cholesterol and low levels of HDL cholesterol, our risk of heart disease increases. Recent research has shown that dietary cholesterol may not have as big of an impact on our blood cholesterol levels as we once thought. Dietary cholesterol may not be the main culprit when it comes to high blood cholesterol levels. Other factors, such as saturated and trans fats, can have a much bigger impact on our cholesterol levels. The type of carbohydrates we eat, as well as our overall lifestyle, can also play a role in our cholesterol levels. Recent studies have found that for most people, dietary cholesterol has a minimal effect on blood cholesterol levels. This means that eating foods high in cholesterol, such as eggs, may not be as bad for us as we once thought. In conclusion, understanding cholesterol is key to making healthy choices. By knowing the truth behind common cholesterol myths, we can take control of our health and make informed decisions about our diets and lifestyles. Thanks for watching. If you've got any personal experiences with cholesterol or tips for managing it, please share them in the comments below, and don't forget to check out our other video on heart health for more information.